Welcome to Living Healthy with COPD. Subscribe and hit the notification bell. Have a sinking feeling about your doctor? Staying with a doctor you're not happy with is as harmful as staying in relationship you know is bad because it is easier than making a change. But parting ways may be the healthiest move. Changing doctors can be a challenging process. Before you invest time figuring out how to switch doctors, it's important to analyze whether such a change is necessary. Here are a few signs it's time to fire your doctor.
You don't feel comfortable with your doctor. Doctors need to know intimate details you may not even share with friends or family members. If you're unable to disclose such facts, you and your doctor may not be the right match. A sense of unease about his or her decisions and recommendations, even if you can't say exactly why, is also a perfectly legitimate reason for cutting the cord, says Don Powell, President and CEO of the American Institute for Preventive Medicine, a nonprofit that promotes healthy behavior through wellness programs and publications. Beware of sloppy medical mistakes. 2. If your doctor prescribes a medication to which you're allergic, and you know that information is in your history, a separation may be in order.
Your physician doesn't coordinate with other doctors. Your primary care physician should be the quarterback of your healthcare team, managing each step of the medical process. That means keeping track of specialists' reports and instructions and talking with you about their recommendations. If he or she is slacking, an important piece of your care could slip through the cracks.
Your doctor's unreachable. A good doctor is available for follow-up questions and concerns. Patient advocate Tricia Torrey, founder of the Alliance of Professional Health Advocates and author of You Bet Your Life. The 10 mistakes every patient makes, recalls the time her husband developed severe tooth pain on a weekend. His dentist's voicemail included a cell phone number and a promise of a quick response, but he never heard back. An emergency clinic visit and root canal later, he told his dentist she was fired. A growing number of doctors are making themselves available to patients via email, text message, and Skype, and at the very least, you need to know that in an emergency, you won't be left hanging.
Your physician's rude or condescending. If your physician has you wondering why are doctors so rude, it's time to part ways. Same goes if he or she trivializes your concerns as though they're not valid. One of the clearest signs you should move on is if he or she walks out of the room while you're still talking, Clancy says. That's what happened when her sister met with a surgeon to determine if her daughter should go through with the procedure. When my sister finished asking her question, the doctor was gone, Clancy recalls. She called me afterward and I told her, "You have to find someone else. You'll regret it if you don't."
Your doctor's a reluctant learner. Whether your doctor went to medical school 3 or 30 years ago, make sure you have access to his or her curriculum vitae. The CV, or resume, can provide you a great picture of how in touch your doctor is with medical advances, Anon says. For example, techniques to treat back pain have advanced in the last 30 years. You want to make sure he is keeping pace, Anon says. The CV will tell you what conferences the physician has attended, what current continuing education they are receiving and whether they're training other medical professionals in their field. A doctor could provide such education by speaking at conferences, conducting research studies or authoring journal articles or textbook chapters on whatever his or her specialty is, whether it's cardiovascular health or spinal conditions.
Review what other patients have said about doctors. You can use online tools to see how others have rated a particular doctor. ProPublica's Vital Signs database, for example, has a section that calculates death and complication rates for surgeons performing one of 8 elective procedures in Medicare between 2009 and 2013. The site rates 16,019 surgeons. That's not quite half of the 41,190 surgeons there were in the U.S. as of May 2016, according to the Bureau of Labor Statistics. Healthgrades.com has more than 6.8 million published reviews and ratings of doctors by patients, says Dr. Brad Bowman, Chief Medical Officer of the website. Consumers can use Healthgrades to search profiles of more than 1.1 million physicians, including doctors in all specialties and subspecialties nationwide. Healthgrades asks reviewers to consider these 8 criteria when reviewing their doctor: ease of scheduling appointments, office environment, including cleanliness and comfort, staff friendliness and courteousness, total wait time, including the waiting room and exam rooms, level of trust in the physician's decisions, how well the provider explains medical conditions, how well the doctor listens and answers questions, and whether the physician spends the appropriate amount of time with patients. Living Health with COPD. Subscribe for daily video uploads. We have videos for everything COPD. From daily motivational videos, to exercise tips, health tips, diet and supplement tips, study and article reviews. Hit the notification bell so you can be notified of our daily videos. Have a blessed day and be COPD strong.